to the OLLI at SBU lecture series. Today we have part 2 with Dr. Absar, who is on staff at Stony Brook. She holds joint appointments as an academic faculty at Renaissance School of Medicine and as clinical assistant professor in the Department of Neurology and Department of Psychiatry and Behavioral Health. I will let her tell you a little bit more about herself, but we are overjoyed to have her for part 2 of this wonderful lecture, and she has some treats for us at the end of this. So Dr. Absar, welcome.
Hello there. Thank you so much for having me again. Thank you, everybody. So with introduction that Elizabeth gave us about our presentation, the part 1 we did was neurocognitive disorder. This is a little different, so this is going to be much fun. It's going to be more on topics like how do you slow down our progression, how do you keep our brain healthy as possible, as long as possible, without dementia or minimizing dementia symptom. So we're going to talk a little bit different aspects of disorder, neurocognitive health. So this is called neurocognitive health. So I'm going to talk a lot about different intervention, what we can do. So let me share my screen.
And Dr. Absar, you'd like the questions at the end, correct?
Yes, please. So that would be better. And also, I do have a, as she said, I have a treat for you guys. We're going to do some hands-on training, hands-on practice, maybe that's the right word, to do some relaxation in the end. So if you do have a little stool or a table or a desk in front of you, that would be nice, because we're going to do some yoga pose while you're sitting in the chair. So it's going to be easy as long as you have a little table where you can just put your heads down in front, so that I will guide you for meditation with those poses, okay? So let me share my screen. All right, can you see my screen okay?
That's great, yes.
Okay, good. All right, so again, I'm just sharing that I have a couple of hats that I wear, the neurology, psychiatry hat, as well as I'm going to talk a little bit in this presentation from a third hat, which is my, training as a yoga teacher. So that would be a little bit different hat that I'm going to share some of the experience that I have as a yoga teacher and as a spiritual healer on neurocognitive disorder, especially dementia and neuropsychiatric disease like depression and sleep disorder. So that would be a completely different scope of the educational background other than neurology and psychiatry. So that's what I wanted to disclose, that I'm going to talk about all 3 different specialties. I don't have any financial disclosure or anything. So my first presentation, that first slide that you can see, this is the same slide I think I shared a little bit last presentation, but this is more summary, that how the healthy aging and dementia is separated. So if I can have you guys, going through a little bit of memorabilia, like what we discussed last week about what is healthy aging when you cross the border, like a Texas and Mexico border, to go to the other side of the border, which would be the dementia side. So the healthy aging means normal aging. We have no brain pathology, meaning we have no this abnormal sort of protein that cause different dementia. So in case of Alzheimer's disease, there are 2 proteins we know. One is called amyloid, one is called tau protein. So these are the protein abnormalities. We have similar protein in Parkinson's disease, Huntington's disease, Lewy body dementia, all kind of different dementia have different abnormal chemical or protein accumulation that is the cause of the pathology of different dementia. So healthy aging means we don't have any of those. We're just getting older. We have no brain pathology, and therefore we don't have any symptoms or any kind of problem. That can be gracefully go on for a long time. In certain cases, we don't know why. We're gonna try to figure out few of them today, but some of them are not modifiable, like genetic factors may be responsible. Some of them may be age, like advanced age is responsible. Some of them may be a little bit of sex, like female gender might be more susceptible in certain dementia, like Alzheimer's disease, whereas a lot of vascular disease affect men more than female because of the underlying heart disease or, high cholesterol or blood pressure issue. So those are not modifiable, but what are the modifiable risk factors are, we're going to talk a lot about that today, like diet, exercise, good sleep, good mood, lack of stress, no stress. Those are all healthy for us to continue our cognitive health. But this first stage, that the healthy aging, we have nothing else. We have just everything graceful. We're just getting older. Then because of those genetic or non-genetic, those risk factors, whatever is the reason, some of these abnormal, or some of this normal protein actually transformed into abnormal form by almost like a mutation in the genetically by molecular mutation, so that there is a form of amyloid called A-beta-42 and a form of tau protein, they call it hyperphosphorylated tau or TAU, tau elevated. This becomes accumulated in the brain, and that is the onset and the cause of this Alzheimer's disease. But when that happens, we also talked last week that it takes almost decade, up to 20 years to develop symptom. So that's why this stage is called pathological stage, meaning you can only see by biopsy, which is impossible before anybody die. Or nowadays we have amyloid PET scan or a tau tangle PET scan that is available for, it's not yet, covered by Medicare for commercial use, but these are available for research protocol. Those very soon will be covered by Medicare. Those can also see if you have any form of proteins, abnormal accumulation of those chemicals in the brain. But clinically, you still don't have symptom. As I said, it takes 15 to almost 20 years sometimes to make symptoms after you have the brain pathology development. And that can goes on, as I said, up to 15, 20 years. Then they have something called prodromal dementia, meaning almost like a pre-dementia, where you have some symptoms like subjective and objective symptoms, but you have no decline in activities of daily living skills, meaning you can still drive, you can still do work, you can still make decision for your banking, for anything, and you can still do everything that you are doing, but you do know that you are not as sharp as before, you have some decline in your cognitive functioning, and objectively, your family can also note that. And also there are some evidence clinically, when you do the testing, we also can see some changes, but that's not enough to make a big impact on you. So your activities of daily living skills, like taking a shower, taking a bath, cooking, shopping, banking, everything, driving, everything's still fine. And that is what we call MCI, mild cognitive impairment. We have to remember not all MCI go to dementia phase, but majority does, as we don't know why again, maybe because of those risk factors that we have. And then a lot of environment, genetics, all of those together. And then when you cross the border between the Texas and Mexico, remember we said the other side is dementia, the one side is not dementia. what is that borderline? At the border is the activities of daily living skills, meaning when you lose that ability to self-govern or take care of yourself, then you are on the other side of the border. And that is called dementia. And dementia can be staged from mild dementia, moderate dementia, severe dementia, according to the rating scales that we do, different kind of testing, cognitive testing manuals that can be applied to determine if it is a mild or if it is a moderate or if it is a severe stage. Okay, so this is a fine, really nice review of everything we discussed last week. So basically how the healthy aging goes into dementia. So this focus of today's talk would be more, how can we keep ourselves at the stage 1, healthy aging, so that we don't go downhill, okay, as much as possible. So these are the chemical changes. I'm not going to bore you. We already talked about that last week. So just a picture, glance of the picture of the amyloid plaques of the amyloid. They call it A beta plaques. And then tau tangle, these are the blackish and then this pinkish. Those are the onset of Alzheimer's disease in the brain. And then this is the new scan that's called amyloid PET scan that can actually diagnose amyloid, positive amyloid status in the brain. That's how you diagnose nowadays, with Alzheimer's disease. So how can we keep ourselves at the healthy aging so that as long as possible, we can keep ourselves with a healthy brain? What we find out that there are risk factors for dementia, or risk factor for impaired cognition or impaired cognitive health. The number 1 is the obesity and sedentary lifestyle and lack of exercise. So we have to make sure we eat healthy and do physical exercise or movement. It doesn't have to be a exercise. Even walking is a good exercise. So I'm not talking about like a traditional exercise. Moving constantly is a good exercise. So constant sedentary lifestyle, when you're sitting there doing nothing, is really putting your burden to your heart, and your heart puts burden to your brain. And that's bad for your heart disease and bad for your stroke, as well as bad for Alzheimer's disease. And then, of course, the obesity is the biggest risk factor for diabetes, high blood pressure, cholesterol, stroke, heart disease, and Alzheimer's disease and other dementia. Smoking, we know smoking is bad for your heart, bad for blood pressure, bad for stroke. It's actually also, anything bad for your heart is ultimately bad for your brain. So it is definitely bad for your cognition. Drug abuse, definitely not a good thing, with alcohol can cause itself dementia symptom. It can cause degeneration of the brain like Alzheimer's disease on its own. A lot of other drugs like cocaine can cause stroke-like syndrome, myocardial infarction, and then it can precipitate for vascular dementia-like symptoms secondary to stroke and heart disease. Cardiovascular disease we talked about, that is a prodromal kind of or predominant risk factor for dementia. Diabetes is one of the major risk factors. So, if you do have diabetes and heart disease, it doesn't mean that you're going to have a dementia. It means that you have to be very, very good with your diabetic control, your heart disease control, see a cardiologist, see an endocrinologist regularly, listen to them, follow their direction, be compliant with your diet, like, low fat, low carbohydrate. If you're a diabetes, then a diabetic diet, so that overall your hemoglobin A1C for diabetic control or your blood pressure and cholesterol for heart disease control are stable. Same thing with the high blood pressure, cholesterol, stroke, head injury. Every time you injure a head, it doesn't have to be a big head injury. Even minor falls like concussion can put head into this trauma zone, and multiple trauma with those concussion can a type of dementia now we call CTE, chronic traumatic encephalopathy, which happens with a lot of younger NFL players that you know, football players, sports, contact sports like soccer, boxing, rugby, any kind of contact sports can put you on a high risk for those head injury and concussion and related dementia. Sleep is a big problem. Sleep disorder, I'm going to spend a lot of time talking about sleep disorder, stress and mood disorder like depression, as well as the final thing is sensory deprivation. What is meant by that? Sensory deprivation means if you have a problem with your sensation, like sensory loss, like lack of hearing or lack of vision, it has to be corrected, because chances are if you're not hearing well, you're not learning or you're not understanding what's happening around you. So you may feel or look like dementia, but the good thing is if you have a good hearing aid, it may actually improve. Your alertness may improve. Same thing with the vision. If you're not seeing properly, it makes you so confusing situation, like what you, it not only feel you depressed, but also it makes you not able to follow through complex directions. So the visual and the hearing need to be corrected before we really have a formal dementia evaluation, or at least have minimized as much as possible, because those can mimic dementia-like symptoms. So in summary, the neurocognitive health comes with definitely stress management, sleep management, vascular risk factor management, seeing a cardiologist, seeing an endocrinologist for diabetes, seeing a primary care physician for a wellness visit. Make sure your blood pressure, cholesterol, kidney, liver, everything is well controlled. Improving the sedentary lifestyle, and join up a YMCA or some kind of swimming activity or walking or any kind of moving exercise. And if you do have underlying depression and anxiety, make sure you have a psychiatrist or psychologist or primary care physician taking care of those. Healthy brain food. So the food is very important. We're going to talk about that a little bit later. A diet called Mind Diet, which is very much, has some evidence, at least initial evidence, to slow down neurodegeneration, and also other Mediterranean, other healthy choice, as very important to maintain. Again, brain healthy and heart healthy food. So whatever good for your heart will be good for your brain. Physical exercise we talked about. If you are in a wheelchair and you think you can't walk or you can't do any exercise, no, I have news for you. You can still do chair yoga. You can still do chair exercise like stretching, daily mobilizing your movement, mobilizing your limbs, even when you can't move or when you have limited mobility. So we're going to do a little bit of the chair yoga in the end of this presentation, just a little bit of the mindfulness training. And then mental exercise like reading is the biggest exercise for brain. And the more you read, old days, they used to say what? Eating one apple will cure the disease or have anything away from you, all the disease away. Reading a book will help you to, get rid of the dementia as long as possible, because reading is a great, any education, anything that you critically think or critically learn every day is good for your brain. And then there are some specific cognitive exercise like crossword puzzles, Sudoku, any brain game, or learning new tools a day, learning a cooking show, learning a game, learning anything new, like watching Discovery Channel and learning something is a good thing. Anything that you learn will create activities in the brain. So again, summary of the prevention part, have the periodic wellness visit at least once a year. Management of chronic medical conditions like diabetes, high blood pressure, cholesterol, and heart disease. Avoid prescription medication that can be contradictory or contraindication for your age, because as we get older, we lose certain chemicals that induce memory and confusion problem. One of them is called acetylcholine, and one of them is called acetylcholine, and one of them is called histamine. Acetylcholine, I'll talk about that a little bit later, but bottom line is acetylcholine is the reason for memory and alertness. So the memory medication like Aricept increase the acetylcholine. But there are other medications available. Suppose use it in certain specialty in neurology and psychiatry. They use it for movement disorder, tremor, called anticholinergic, meaning anti-acetylcholine. That's great for your tremor, but worse for your memory because that will deplete. It's anticholinergic, meaning anti-acetylcholine. So it will decrease the acetylcholine. And as we get older, we already losing our acetylcholine. And in Alzheimer's disease, we lose in acetylcholine a lot. So when you use those meds, you almost artificially make you demented. So be aware about that. There is a very specific medication urologists practice for urinary incontinence called ditropin, which is a strong anticholinergic medication. So if you are on those, or if you have trouble, make sure urologists know that you don't want any medication that can interfere with your memory. Same thing with antihistamine. So histamine makes us alert and awake in the brain. Histamine is in our brain chemical. Antihistamine means anti-alertness, meaning medication that can make you drowsy and sleepy. And these are the medication used in over-the-counter pharmacy. You don't need a prescription, like Benadryl or any allergy medication, common cold medication, sleep medication. They all have antihistamine. So if you are 65 and over, or if you have any concern of memory, please do not take those medications without talking to a pharmacist or your medical provider, because there are so many other alternative medications available for sleep or common cold or sleep that are not antihistamine, and it's going to be good for you. Similar like benzodiazepine, which is a class of compound called Ativan, Klonopin, Xanax. Those are dangerous for memory because one of the side effects can be amnesia or ataxia, meaning amnesia means loss of memory. Ataxia means unsteadiness. So meaning you can increase your fall risk and you can look like demented. So those are not a good medicine to take for long term. So always remember to talk to primary care, make sure that they can look at your medication regimen and go through the list. Whatever medication can interfere with your memory should be eliminated, completely eliminated from your regimen. And then limit alcohol and avoid drinking, especially if you are taking any depressive drug, not depression drug, but any medication that can cause depression in the nervous system, like pain medication, depression medication, a lot of sleep medication. These are all depressant drugs. So if you take alcohol, which also depresses your brain, then you can have a cumulative effect, like a combined effect of more depression in the brain, makes you more confused. Quit smoking or have a drug rehab. And of course, the sleep hygiene is the most important, sleeping at least 7 to 8 hours. And we'll talk about the sleep phase later. So this is the sign how sleep can be interfering with the cognition. We all know if you have a good night's sleep, you will have a good day. You can remember better. You are more sharper than the day that you are dizzy or drowsy or sleepy, because you cannot focus anything and your memory, almost like you can remember things. So we see that all the time. So every time I see a patient for Alzheimer's disease, I go through sleep questionnaire. And if I see any evidence of sleep apnea, especially anybody snoring or anybody has trouble, waking up in the middle of the night, like with the air hunger, then of course I tell them, send them to sleep lab for a overnight sleep studies to rule out sleep apnea. And it's so treatable. Sleep apnea, you can have a CPAP machine. There are medications to keep you alert and awake during the daytime if you have sleep apnea, which makes your attention, your sleep so much better. Your depression gets better because every sleep apnea comes with depression, drowsiness during the daytime, or even in extreme case, narcolepsy-like symptom. So when we have medications, so these are called reversible dementia, meaning you can actually treat this symptom by just treating the underlying symptom. So we definitely can do that. So sleep is important, we know that. How does it relate to cognition? We know that memory functioning, the way that we remember things, has multiple steps. So I'll give you an example. Everything that I'm talking to you right now, you may not have everything, registered in your brain. This process of acquisition of new information get into the hippocampus, which then get into a chemical called glutamate. This glutamate is a chemical, it's a neurotransmitter, it is a brain chemical, comes only during the night, during the REM sleep, during the slow wave sleep at night, when these integrate everything that you learn all day long into a long-term memory. So say, suppose you're listening to me and you're really focusing what I'm saying. But you know what? Your hippocampus right now is just lighting up to encode or acquisition of those information, but it's not making any long-term memory yet until you go to bed tonight. When this glutamate comes to hippocampus during the slow wave phase of the sleep, slow wave sleep phase, and then it may ask the hippocampus, hey buddy, what did you learn all day long? And hippocampus may say, see, I go into Dr. Absar and she gave me all the information. And glutamate may say, do you want me to make some long-term memory so you can remember them better? And hippocampus is like, you know what, be my guest, do all the memory, all the formation of new memory you want. So only when you're sleeping, hippocampus and glutamate integrate those, what we call consolidation of memory. This consolidation, meaning combining this acquisition of the information that you have all day long, new learning that you have, into a long-term memory formation. So that's how the memory formation happened during night. However, in the morning, hippocampus becomes a very small, it's a very small storage capacity. So everything that you learn every day and that at night, that memory formed by the glutamate in the condensation process, this hippocampus becoming out of storage. So hippocampus become kind of completely out of storage area, like computer. When you have too much data, too much music in a laptop or a computer or an iPhone, then you can't store anymore. So then hippocampus start crying for help, that help, 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 I'm out of storage. And then this frontal lobe and some of the association cortex, they have a lot of different cabinets, like a filing cabinet. They say, buddy, I can help you. And frontal lobe become the more generous part with this association cortex, where those memory can be stored for long term. So hippocampus actually learning and retaining information initially, and then long-term information stored in this association area. So that's how those are the memory center, memory areas of the brain that integrate together. So if you didn't sleep tonight, guess what? This glutamate and hippocampus didn't talk to each other, meaning your consolidation of the memory didn't happen. So if somebody asks you tomorrow, what did you learn from Dr. Absar? You may not be able to answer because you may lose everything that is it. So the sleep disorder can look like dementia. So sleep disorder is a number one reason, number one cause of reversible dementia. But the good thing is it's reversible, meaning if your sleep is improved, if you're sleeping better, you can memorize better. So sleep is an essential part of cognition. We also, I have to check one more thing. I'm not going to go details, but this is a very early preliminary research just came out and presented in our last conference in the behavioral neurology conference, that they found out when you are in that consolidation phase of the sleep, meaning, if we're in the slow wave sleep, they say that every time you're this slow wave sleep happen, the blood gushes to the slow wave sleep, you actually make a CSF, meaning cerebrospinal fluid clearance in the what they call ventricles, meaning you can see the CSF, which is usually at the drainage system in the brain. It drains all the toxins, like all the toxins when the amyloid and tau become toxic mutant. This is the CSF is the one that takes them away from the brain. So every time that you have a slow wave phase of the sleep, meaning you have this consolidation happening, one of the gush of fluid gets into this third ventricle. They actually showed it in vivo in a wonderful video, in fMRI video in the conference. So meaning what? Meaning they are now thinking that during the slow wave sleep, it may be also the CSF clear all the toxins. So if you're not having sleep, a lot of the toxin can be retaining in the brain. Again, this is very early preliminary data of the research. We're still learning a lot about sleep and cognitive processing. So the sleep disorder, I say, a prodromal stage of dementia, not just Alzheimer's disease, any type of dementia. So there is a, this amyloid and tau that we talked about in the first slide, that prodromal and then the pathological stage, that's for the Alzheimer's disease. Same kind of chemicals in proteins, another one called alpha-synuclein. This alpha-synuclein cause a lot of different diseases like Parkinson's disease, PDD, like Parkinson's disease dementia, and dementia with Lewy body, meaning these alpha-synuclein get accumulated, and these alpha-synuclein produce, these are the diseases in the end, like amyloid and tau can cause the Alzheimer's disease. So what we find out that this alpha-synuclein is also cause this REM sleep disorder, meaning a sleep disorder where you have too much of the REM sleep, meaning this dream-like sleep, which is often fragmentation of the sleep. So you wake up multiple times, your sleep doesn't last that long. You have a lot of, they call it paradoxical sleep, meaning your body is actually, you're sleeping, but your heart and lung is working really hard. So it's a paradoxical state where, when you wake up, you don't feel rested. You feel like, although you slept all night, you may not feel like rested. So it's not that restful sleep often. And that can be often associated with a dream-like sleep. And those dreams, sometimes people act out. They call it RBD, rapid eye movement behavior disorder, meaning people can scream and yell or punch. The best way I diagnose them, first I talk to patient's spouse and I said, are you guys sleeping together? And they're like, no, hell no. I stopped sleeping with him for a couple of years ago. I said, why? And she's like, well, he keep punching me all night long. And I'm like, I asked him and he had no idea because he does it in his sleep. So that's the common symptoms you see with RBD. Basically, he was dreaming about punching somebody. So next to him is the partner. So he started punching. So this is a great report you can get by talking to the spouse or the partner, whether your spouse has any abnormality during sleep. So REM sleep and RBD is a prodromal syndrome of not only Parkinson's disease, but also dementia with Lewy body. It's very common in both of those diseases. So sleep disorder, especially REM behavior disorders, the RBD that is the earliest, they call it non-motor manifestation, meaning it's not like tremor, non-motor. Motor means the tremor and movement disorder. So it's a non-motor manifestations of Parkinson's. So before you get tremor, they often get this dreamlike behavior way before like that, especially same for Lewy body dementia. If it is a Alzheimer's disease or other neurodegenerative dementia, this is the reason we get the circadian dysregulation, what we call sundowning, meaning their melatonin become imbalanced in the brain. So their day become night, night becomes day. So they become up all night or get worse in the nighttime, get more confused as the days goes by, especially next weekend or this coming weekend. We're gonna adjust our clock, yeah, because we're gonna have winter time. We're gonna have this early evening hour, and that means patient who has dementia will be more prone to develop sundowning in earlier hour now, because it would be evening, it would be dark too early in the day, and that can cause lot of behavioral issue, lot of confusion, lot of agitation with patient with cognitive symptom. And that is also a symptom of the sleep-wake cycle. We see that, even UTI pneumonia can cause an abrupt onset of confusion, what we call delirium. And this delirium also disrupts the neural pathway that makes us arousal, like alert. So people get sleepy, drowsy when they have a UTI or pneumonia or dehydration, and people need to go to the hospital for acute medical care, because that can be life-threatening for them. As I said, sleep apnea can be a reversible cause of dementia. Depression also comes with sleep problem. They call it early morning awakening. That's one of the earliest signs of depression. What I meant by early morning awakening, meaning they sleep until like 3 in the morning maybe, and they wake up 3 or 3:30 and they can't get back to sleep. It's too early for them. So normally their usual wake up time is 7 a.m. Now they wake up at 4 a.m. and they can function because they feel like they're up in these 3 hours before their actual wake up time. That's one of the earliest signs of depression sometimes. We talked about that. So the sleep signs in depression, EMW or early morning awakening is a diagnostic hallmark for depression. So when you take a sleep history for anybody with depression, you'll see you can actually measure that with doing a EEG, like electroencephalogram or a sleep study. If somebody has depression, you can see they go to REM sleep, meaning their REM latency. Latency means the time that you fall in sleep and the time that you go to dream sleep. Normally, we don't go to the dream sleep until later part of the night or early morning hour, because we have other stages of sleep. They call it non-REM sleep, meaning non-dreamlike sleep. And that goes on and on until about 1 o'clock, 2 o'clock, and then start the REM sleep, which usually happen only 90 minutes long. And then you go back, come back, go back, come back. That way until you wake up, you have more and more REM towards the end of the night. That's what you dream more in the early morning hour rather than initial hour. So these are the REM sleep. So when you decrease the REM sleep, meaning you're going to directly to the dream-like sleep early, that's the sign of depression. So your total REM sleep has actually increased during somebody with a depression symptom, meaning they have a lot of nightmares, a lot of bad dreams, and they have a lot of multiple nocturnal multiple awakening at night. And then finally, when they wake up, it's too early in the mornings. They call it EMW. So depression also happen if you have a sleep disturbance, or vice versa. Sleep disturbance can also seen if you have depression. All the depression, stress, and sleep or memory, these are all also interaction with a lot of chemicals. I talked about acetylcholine for memory. I talked about last time we talked about serotonin and dopamine. We talk a little bit about that. Serotonin, we know one of the molecules for a lot of diseases like depression, anxiety, migraine, obsessive compulsion, pain. So those are one of the example of serotonin dysfunction, like neuropathy can cause by serotonin dysfunction. Dopamine can also cause the mood, affect, happiness. A lack of dopamine cause Parkinson's disease. Too much dopamine can cause psychotic disease like schizophrenia. So these are the chemicals that we have in our brain that interfere with a lot of our experience, like not only emotional experience, our movement experience, like Parkinson's disease will limit our movement, Huntington's disease will limit our movement, or our thinking process, like in schizophrenia, we have alteration in thinking, or our affective experience, our mood, like depression or mania or anxiety. So these are all the chemicals that play in our brain, called chemical imbalance, that cause all kinds of diseases. And then we also have food that is important, because remember, all those chemicals in the brain I'm talking about, some of them are essential amino acids, meaning in simple English, meaning they can't be synthesized in the brain. We've got to supply them through our diet. So this is a good slide from 1826 biographer who wrote that, a French biographer who wrote, "You are what you eat." He said, "Tell me what you eat, I'll tell you who you are." Meaning we can define ourselves by the way we look and we eat, because the way that we eat, you can actually look at their personality, how so healthy eating is so important to heart healthy, brain healthy. It's so important for us to always remember to basically that, we have to take responsibility for what we eat. We can't just blame, oh, I have a disease. We have so much control over that, but sometimes we don't associate, we don't connect the dot that, oh, I'm just going to have one donut. Who cares? Maybe my sugar will be fine. No, your sugar is not going to be fine. Your hemoglobin A1C will fluctuate. So we have to have discipline. We have to bring discipline with our diet. Everything is moderation, like the old days, like our moms and dads used to eat. No processed food, all the fresh foods coming from the, from the farming market or farmer's market, or all the, real farm. We don't have those, but at least we can have as much as possible non-processed food, organic food, or, things that good for our heart, good for our brain. So these are the chemicals that we supply with our food. Brain, they call it monoamine, meaning these are the amines or protein product that is our neurotransmitter that we talked about, that sometimes comes to dopamine, which is one of the neurotransmitter, to epinephrine that you guys all know about, epi injection. If you have an allergy, you can life-save EpiPen that can help you with the severe anaphylactic reaction from allergy. Norepinephrine cause blood pressure increase, depression, anxiety. So all the things are similar. It comes from the same dietary amino acid called tyrosine. So if you have food which is rich with tyrosine, you're going to be good with all of the chemicals in the brain. So what are the foods good with tyrosine? We can see all the brain nuts, like an almond, all the nutty seed is good. Avocado is really good. Banana has not only tyrosine, banana also has a tryptophan. So banana is good for serotonin, dopamine, a lot of the things. When I was in medical school, we used to, not medical school, residency, I mean, we used to tease each other, say, one banana 3 times a day is a good depression medicine. So you really get a good dietary instinct of norepinephrine, dopamine, as well as serotonin, which is good for our mood. Dairy products, beans like pumpkin seeds, almond, sesame seed, dark chocolate, those are all high source for tyrosine, as well as some animal products, and definitely omega-3 fatty acid rich fish like salmon. And then dopamine, we talked about. Dopamine is the molecule of so many functioning. I'm just putting up with some of them. It's a molecule for attention, focusing. So if you think about all the little kids with ADHD, they basically have developmentally based dopamine imbalance. That's why they take sometimes stimulant, which is basically a dopamine they take. Attention can also be impaired if you have depression. So depression can cause lack of attention, and lack of attention can cause lack of memory because you are not focusing, so you're not remembering things. Dopamine is a molecule for motivation, happiness. It's a molecule for pleasure, love, molecule for movement. And too much dopamine is not good because that can cause you what they call hallucination, like perception problem, delusion, hallucination in psychiatry. Those are too much dopamine, whereas the lack of dopamine can cause like Parkinson's disease, lack of movement, or depression. So these are all, including sexual arousal, blood pressure control, heart rate control, autonomic control. These are all dopamine function. So this was a nice slide. I think I might have shared with you last time, but if I'm not, I will share again. This is a nice thing I shared with everybody. This was after I got into my yoga teacher's training. One of my yoga teachers, she was really good with me doing a lot of workshop, like a presentation for people, like a healthcare professional, to learn about this kind of intervention, like exercise for brain. So one day there was I think it was around the Valentine's Day. I told her that I would like to present something for Valentine's Day. Maybe you will invite people, it would be nice Valentine's Day get together. So she said that, oh, that's great. What would be the topic of your talk? I said, my talk would be captioned as, will you be my dopamine? Meaning, instead of saying, will you be my Valentine, I would say, will you be my dopamine? She said, why? I said, well, you see about Valentine's Day, all the attraction, all the love, all the, people fall in love with each other. This is all the chemical play. It's actually caused by dopamine in the brain. Dopamine is the happiness. That's why you make me so happy when I'm with my loved one. So instead of saying, will you be my Valentine's? How about we say, will you be my dopamine? She's like, no, we don't want to do that. Let's just leave it as, will you be my Valentine's Day? But in a way, it's funny, but in a way, it's similar that dopamine is actually the reason for a lot of happiness. That's why things that makes us happy, we do it over and over, yeah? So sometimes this is a bad things we learn and cause addiction. So all the addiction is also dopaminergic dysfunction is a part of the brain called nucleus accumbens, which is basically a addictive part of the brain where whether you are an alcoholic or chocolate addict or sex addict or love addict or gambling addict or cocaine addict, every time you have some pleasurable activity, something makes you happy, a little bit of dopamine put in that nucleus accumbens. So this is what is so important to know how the dopamine happen. even when you break up in a relationship, you almost like you lack dopamine. So there you get so depressed. Then what do? We eat chocolate, because why? Your body knows chocolate has dopamine. So when basically what we're doing, self-medicating chocolate, make you happy again. See, this is how the whole chemical can interchange. So the chocolate, love, sex, these are all dopamine, addictive behavior. So the molecule of dopamine has so many different ways interact in our life. And depletion of dopamine we talked about cause Parkinson's disease, depression, apathy, ADD, restless leg syndrome. Too much dopamine cause psychotic disease like schizophrenia. So dopamine is essential. So we have to make sure the diet that we talked about in moderation, we should have that. Acetylcholine is also very important. We talked initially when I was talking about the memory and avoiding prescription drug that is anti-acetylcholine, like ditropan for bladder, or cogentin, for example, for movement disorder like tremor. Those are all anti-acetylcholine. See, the acetylcholine, I don't want you to go through the whole complex chemical reaction, but here there's a homocysteine need. So basically a vitamin process, catalytic process by vitamin B6, B12, and folic acid, catalyze the reaction between the homocysteine to acetylcholine. So that's why acetylcholine gets synthesized in the brain. So it is the important part of the memory and cognition. So if you don't supply the vitamin B6, B12, or folic acid in your diet, this reaction cannot happen. So those vitamin deficiency can also cause cause the dementia-like symptom. They call it reversible dementia. Choline can be found in so many foods. Egg yolk has the richest choline. Wheat products, soybeans, seafoods has that. And also meats has, animal meat, especially animal food meat has acetylcholine. But seafood has definitely egg yolk has a choline, which can catalyze with this kind of reaction to make acetylcholine help with the memory formation. I talked about the serotonin that comes from tryptophan. Tryptophan, and not only the banana, but when we eat turkey, turkey has the highest tryptophan. So think about our Thanksgiving dinner is coming. We're going to eat turkey a lot. So what happened when you eat turkey? So we eat turkey like we eat like crazy in the Thanksgiving dinner, eating for an hour. And then you feel so happy because tryptophan makes serotonin, happiness comes. But the melatonin is from serotonin. So breakdown of serotonin makes melatonin. So in the end, after a few hours, what happened after Thanksgiving evening? Everybody watching football game and falling asleep on their couch. They're all sleepy. Now they're sleepy because they have too much melatonin now. No more serotonin. So tryptophan to melatonin, serotonin to melatonin. This is like a live way you can see how this chemical that you eat and how you behave. You have so much control how you feel, how you behave, if we can have a good eating habit, good eating schedule. Again, tryptophan is abundant in the nature with so many different foods you can see. Everything is in moderation. If you have some salmon or eggs, and definitely some nuts, brain nuts like peanuts or walnuts or all the different nuts and berries, it has a lot of serotonin in it. Then the last one is a chemical called GABA, gamma aminobutyric acid. This is another brain chemical that makes us less anxiety. So when you lose the GABA, it's a disease called anxiety disorder or panic disorder. You can also get loss of GABA makes another disease called epilepsy, like seizure disorder. So loss of GABA makes epilepsy, anxiety disorders, and and panic disorder, even bipolar disorder has a lack of GABA. So all the things that you take for anxiety or for seizure basically increase the GABA in the brain. Guess what also increase the GABA? Meditation. I'm going to talk a little bit in the end. Meditation increase the GABA in the brain. So any kind of meditation or yoga or mindfulness increase the GABA. So that makes you less anxious, makes you more relaxed and sharp your mental alertness. Whereas lowering GABA will make you nervous, racing thoughts, hyperactivity. And these are the food that you can do. A lot of, nice flowery food like spinach and broccoli and mushroom has a lot of GABA in it, beans and grains. So these are all good source of GABA. So with all those, I'm going to finalize with a diet that I propose. It's not perfect, but so far we do see a lot of different hypotheses saying that, at least based on a couple of studies, that it can lower the neurodegeneration. It's called MIND diet. It's basically combination of two diet together. Mediterranean diet that we all know is good for your heart, good for your cardiac health. So cardiologist has been talking about this for a long time. It's basically tons of fresh fruits, vegetables, fish, and good fat like olive oils, and the plant-based fat like avocado. But Mediterranean diet has also a lot of carbohydrate, potentially has rice and pasta in it, and a lot of red meat in it, which may not be that good because it comes with low density lipoprotein, and it can also comes with high sugar. So that's why the second diet is called DASH diet, DASH, which is basically an abbreviation for dietary approach to stop hypertension. It's a blood pressure diet. It was very popular in the 80s by cardiologists, which is basically developed by NIH, and is very good for reducing blood pressure. It's a low fat and low salt diet. So when you combine the Mediterranean diet with the DASH diet, your pasta and rice is out because it's carbohydrate, and your red meat is out as much as possible. So your Mediterranean diet and a DASH diet combined, the hybrid together is the MIND diet. So they did a study, I'm just going to share, they have quite a few studies. I'm just going to share one of the study, a preliminary study, Scottish study, where they have 963 participants. They divide them into two groups. One group, they instruct them to eat anything. The other group ate only MIND diet recipe. And these are the people 65 and over. They don't have dementia, but they're just 65 and older. Study was 3-year-old. They have 2 scans, 2 MRI in the beginning of the study and the end of the study. So everybody get a baseline MRI, then 2 groups, each one of them MIND diet recipe ate, and the other one ate everything. And then the second MRI they found out the people who followed the MIND diet, they had a sharp decline in the shrinkage in the brain in their MRI comparing to the previous MRI. So that's what there's a lot of things about neurodegeneration delay, that you can slow down the degeneration of the brain. They replicated it at the Rush University Medical Center in Chicago with this Martha Morris. And then it is becoming very popular in neurology, actually sponsored by Academy of Neurology for a lot of neurodegenerative disease. And it stands for MIND, stands for Mediterranean Dash Intervention for Neurodegenerative Delay Diet, MIND. Okay, so those are really, really good for that health choices, but diet cannot just alone prevent any dementia or Alzheimer's disease. As we know, we have non-modifiable risk factors, which we cannot modify, like genetics or other modifiable risk factors. We have to do extra, like quit smoking, do exercise. You have to teach ourselves to have good level of education, and your mental health and cardiac health. All the things are also important. So the diet should be complemented with a structured daily physical exercise, targeting the heart health and brain health, as well as mental and cognitive exercise. Walking is the best exercise, cardiac exercise, as you can, if you can do some treadmills or run or walk or bike or swim, those would be great. If you have limitation, I think the best alternate would be yoga and mindfulness. So yoga and mindfulness, not only physical health, but also mental and cognitive health. It improved the chemistry of the brain. Remember the GABA we talked about, gamma aminobutyric acid, which caused the anxiety. It increased the GABA in the prefrontal cortex in the brain. They have really, two research showed, one of my colleagues in Boston, they actually did a great research to found out that people who are doing yoga, they did their transcranial magnetic stimulation to look at their different spectroscopic findings in the GABA utilization in a specialized scan called transcranial magnetic spectroscopy. They found out they had a 62% increase in the prefrontal cortical GABA. This was a study done by Boston University. It's a very good design for yoga. They have another similar by Buddhist monk study for meditation in Sweden. So they have a lot of different study how mindfulness can help with the relaxation in the prefrontal cortex to have your mental and cognitive health improving. So that's how the yoga comes from. Yoga is an Indian Sanskrit word meaning union, meaning the united body, mind, and soul. In modern medicine and modern neurology, we now use the yoga pose in integrated model like physical therapy and occupational therapy. Yoga is becoming a therapy for a lot of psychiatric and neurological disease, as well as medical disease like fibromyalgia, neuropathy, in a lot of neurological disease like MS, Parkinson's, Huntington's disease. So it's not only just good for your body, but with the breathing exercise, it kind of bridges the mind, soul, and the body together. So it's a wonderful option for motivation, mood, attention, sleep, anxiety, obsessive thoughts. So I'm going to do one or two exercises today because we have a little bit of time, and then maybe share some question if you have. So basically, yoga improved these by the complex kind of brain pathway. We're not going to touch that, but that basically cortisol, as you know, cortisol increase the stress. This will relax you. So it's really good for you. It improved what they call parasympathetic nervous system, which counteract the sympathetic nervous system, because sympathetic nervous system is the stress activation system. So as a result of this counteraction, it can calm your body, neutralize the stress and anxiety triggered by the overtly active sympathetic nervous system. So this is all we have with the spiritual God of that Buddhas. I may always share this in the end of my lecture, that Buddha say how much you love, how gently you live your life, and how gracefully you let go things not meant for you. This is all we should look for. You know, we wanted to prioritize that how we can let go things that not good for us, that doesn't help with us with anything. Okay, so let's just do some exercise, and then maybe we can take some question. All right, so let me see if I can you guys see me? I am going to stop sharing.
Okay.
All right, so are you guys ready to do a little bit of breathing and a little bit of stretching? Yeah?
Yes.
Okay, good. All right, so I want you to make sure you are completely relaxed. Just let go. Doesn't matter if you never done yoga. Doesn't matter if you don't do meditation. All the little things that bother you, let it out. Okay. All right. We're just gonna do simple breathing. Nothing else. No fancy thing. Just simple thing. Okay. All right. If you can see me and just follow me, I'm just gonna go as backward as possible so you can see me. All right, we're going to start with some breathing exercise. So I'm going to have you, hold on, I'm going to have some background relaxation music for you. So we can actually have some little bit of relaxation. By the way, this music is the nephew of Ravi Shankar, that Indian classical sitar. He died, but his music is amazing. You come down so much in your relaxing.
Can't hear it yet, Dr. Absar.
I hope it's not too loud though, yeah? Is it too loud? Okay.
Can everybody hear it?
I want you to just let go. Take a deep breath with me. Through the nose. Out through the mouth. Let's do a couple of breathing, just simple breathing. Breathing through the nose. Out through the mouth. Now this time we're gonna breathe through the nose and out forcibly through the mouth, like, okay? Make a noise like that. So take it. Let's do again. Every time you inhale, inhalation is the hope, exhalation is the sadness. So you're gonna take the hope, let out the sadness, let out the anxiety, let out the stress. Let's try again. One more. All right, now I'm going to add a little bit of the breathing techniques. So now, this time we're going to do a little bit what they call 4 parts breathing, meaning we're going to inhale through the nose and then hold it and then exhale through the nose again. So this time we're not going to open the mouth. So keep your mouth shut. So all you do is breathing through the nose and breathe out through the nose. In between, we're going to hold the breath. So inhale and then hold it. And then exhale, then hold it. Then inhale, hold it. And then exhale, hold it. We're going to slowly increase the holding time. So maybe the initial, you can only hold for a second. That's okay. But every time you breathe, try to hold it a little bit longer if you can. Okay, then slowly, but mouth will be closed. So take your relax completely. Try to close your eyes. You don't have to listen to me. Just listen to me. You don't have to see anybody. Close your eyes. Just relax. So breathe in, and then hold. And then through the nose, out, 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 out everything, and then hold. Inhale again through the nose. At the height of the inhale, hold. Exhale through the nose. Expelled everything, and then hold. Inhale through the nose. Hold. Exhale through the nose. Hold. Inhale. Hold it. Exhale. Hold it. Last one. Inhale. Hold it. Exhale. Hold it. Now breathe normally. Now open your eyes. Now let's add some movement with it. So we're gonna add a little by little. So we're gonna just sit on the chair. If you do have a little bit of desk in front of you, that would be nice, because I'm gonna instruct what I'm gonna do. So you can just watch me first, and then so you can do it, okay? So hopefully you can see me okay. All right, so we're gonna do 4 parts breathing again, but this time we're gonna move. They call it moving meditation, meaning we're gonna meditate by moving our limbs. You can do it by standing, or you can also do it in your desk, office desk, when you're sitting there. So we're gonna inhale, breathe. So the first thing is, let's bring up your hands with a prayer position. And this way, we surrender to higher power. We surrender, we have no control. We tell our hierarchy that we are so helpless, but we know what we can do. We know how we can get rid of all the things that we have no control over, like the past, or all the negative thinking or negative process, all the things that we've been harboring in ourselves, so we don't move forward. We're just dragging past all the way, so we can't grow anymore. So we got to let go. So in the beginning, we're gonna determine, put an intention that I am, and I am enough. I am enough. I am enough. I'm beautiful. I'm beautiful. I'm beautiful. With that, inhale through the nose. Exhale through the nose. This time, when you inhale, you go all the way, prayer to the sky. And then exhale, bring the hand back to the heart. All right, so let's do a couple of those. Inhale. Exhale. Inhale. Exhale. This time I'm going to add a little bit. So just to relax, just a demonstration first. Inhale, we're going to go up all the way. And this time we're going to bring our head back a little bit and look up to the ceiling. And hands will be next to your ear, and then bring back. Okay, so just a tiny beginning movement added. So inhale. Do it in a musical fashion, like almost like a music. Inhale. Exhale. One more. Inhale. Exhale. This time we're gonna take our hands, inhalation, we're gonna bring hands all the way to the top. And exhale all the way at the side of the chair. So bring it, make sure you don't do this. Make sure to inhale all the way up, all the way down, all the way up, all the way down. So let's do that. Inhale. Exhale. Remember breathing, inhale, never stop breathing through the nose. Exhale. One more, inhale. This time, put the right hand down and hold the chair with your right hand, and exhale, bring your left hand through the ear, press the ear to bring yourself to the side. And then bring back both hands again. And next, inhale, exhale, the other side. So do the one side and then the other. Bring back Inhale. Let's do the other side now. Exhale to the right. Inhale to the center. Exhale to the left. Inhale to the center. Exhale to the right. Inhale to the center. Exhale to the left. Inhale to the center. Bring your hands back with exhalation to the heart. Now, with this, I think next one, I'm going to do the 4 parts again. This time, I'm going to demonstrate. So inhalation, look up all the way, almost like a back bend. So you're going to look back, as if like you are looking at the ceiling. And exhale all the way to the, if you have a table or something, or if you don't have a table, just bring your hands to your lap and just relax. And then come back again, inhale, exhale. Inhale. If you do have a table, just bring it to the table and just put your heads down. Inhale. Exhale. Inhale. Bring your hands back to the center. Okay, so let's do a couple of these together. So just remember, we're going to start with breathing exercise first with 4 parts breathing. Then we're going to move with the movement, just one form. If you forget, just watch me and just follow me. Okay, inhale. Exhale. Inhale. Exhale. Next, inhale. Right-sided, exhale. Inhale. Left-sided, exhale. Inhale. Right-sided, exhale. Inhale. Left-sided. One more. Inhale. To the center. We can just go back. And just let your head drop. Just relax. Just let go. Just let go everything. Let go what's bothering you. As much comfortable. If you want to put your hands on a resting, if you have a pillow or something, put that in the table, on the table, so that you are relaxed, or a cushion or something. Just let go all the frustration. Let go all the expectation. You are enough. You do not need to do anything. You are enough. You are enough. You are enough. You are already full. You're already whole. You are already whole. We feel that sometimes we look for perfection on others, but we forget we are perfect. We are perfectly imperfect. That's the right word. So everything that we do, we have to be happy. We need to believe ourselves. We need to believe who we are. Come back to the center. Thank you. I would someday, if we can have a in-person demonstration, that I could run like a real class, like a full class with you guys, with doing some movement, not only just on the chair, maybe even on the mat, and do some of the, especially I can show you some of the pose that's really good for different disease. I'm going to just show you one pose. If you can do it when you are really struggling with anxiety or obsession, or sometimes, you know, what we call monkey brain. that you really feel like your brain is like going crazy, and so this is a great exercise. I feel often we do that. It's a great for OCD. I have to tell you, one time, this was from my Boston days after my fellowship. I was a medical director of one of the hospital called Metro West Medical Center in Framingham. And one day I went there in the morning at 7. I have a lady that I saw right in front of the nursing station. She's like 88. She's like talking 100 miles an hour. And the nurse is only 7 a.m. Nurse is already given up, like she had enough of the day. It's only 7 o'clock in the morning. And the nurse is asking me, doctor, you have to give me an order for an Ativan. Ativan means a pill that can help with the relaxation. So I'm always against those kind of pill for elderly. These are called benzodiazepine. Remember, I was showing before that can cause confusion, but they use it for agitation or anxiety a lot. So I said, all right, what's happening? She's been asking me same thing over and over. I had enough. It's only 7 o'clock. I don't know. I can survive all day today. I said, all right, let me take her hands, and I'm going to walk with her. So I took her hands and I started walking, and the nurse is rolling her eyes, and she's like, you're going to walk with pill I can give her so that I can function better. I said, no, she'll be okay. I'll take her for a walk. So I took her. We had a little sanctuary room, like a little bit at this end of the corridor in a room. So I took her there, and I had this exercise, this yoga pose that I'm showing you. So I told her that I'm going to do what they call alternate nostril breathing. So this basically, you put 2 fingers. It's not that pretty to look, but it's okay. You can do it. So you put 2 fingers. Actually, you do this to the thumb, and then little one, you just rest on each side of the nose. So you press one nostril with the thumb, press the other nostril with little finger, tiny, pinky, and rest 3. You just rest on the forehead. Okay. So what you're going to do, you're going to inhale through the right nostril only. So you keep pressing the left. You don't open the left. You would just lose the right thumb so that you take a breath through the right nostril, not mouth though. Make sure your mouth is closed. So inhale, and then close the right, open the left, exhale through the left. Then close the left, open the right, inhale through the right. Close the right, open the left, exhale through the left. Close the left, open the right. Close the right, open the left, exhale through the left. So do it slowly. So you understand what I'm saying. So let's do it a couple of times. And then how it works. So basically what happened is you are fooling your brain. So many times you're changing right, left, right, left, right, left. Your brain already forgot what the brain was anxious about. You're focusing on your breath. You're focusing how you're breathing. Is it a right or a left, right or a left, right or a left? You are focusing, is it the right side, left side, right side, left side? You completely forget why I was anxious on the first place. So this is a great exercise for anxiety disorder, panic disorder, or anything, anytime when you have a monkey brain, when you are at night sleeping, that you can't focus, you can't go to bed, just wake up and do this. And it will help you. It's a great for OCD, obsessive compulsion. People who had this compulsion, they do it. So that lady, few times we did it, she was amazingly well. I didn't need the Ativan pill for her that day, So bottom line is, this is a great therapy for a lot of, it's like a physical therapy. So yoga therapy has been utilized 5,000 years ago in India, and everywhere in the world, I mean, the problem with our Western world is we do yoga like a fashion. So it's becoming a trend, like a hot yoga, like a 90 minutes class. We're not doing real yoga, which is the therapy. Therapy yoga doesn't need a full class. One pose can be a yoga. So, in old days in India, they used to say, hey, Rishi, give me a pose for constipation. And then they were going to say, do go Mukashana, which is basically do this. Take this, and then you sit there with your leg crossed. That will help your bladder, bowel, so that you straight that, you put that in there. So that's one pose is a therapy. That's the treatment for constipation. They have treatment of everything. Back in those days, they didn't have a lot of other medicine. So yoga was utilizing as a therapy for a lot of disease. We forgot. Physical therapists still do yoga in their physical therapy exercise. So you'll see if you have a orthopedic visit, they always encourage you to do yoga, especially physical therapy, because physical therapy is only for a couple of sessions, and then they will give you home exercise, and that would involve some of the yoga. All right, so let's do alternate nostril breathing for a little bit. All right, so remember, right on the right nostril, a thumb, and left pinky on the left nostril. So just remember, when you breathe, just open up that finger and then close it and then open up the other finger. Okay, so let's start. And keep your eyes closed. So no rush, nothing. Just focus on your breath, nothing else. Inhale. Close the right nostril. Open the left. Exhale. Close the left, open right, inhale. Close right, open left, exhale. Close left, open right, inhale. Close right, open left, exhale. Close right, close left, open right. Close right, open left. And then maybe 3 more on your own, at your own pace. Try to slow it down and breathe slowly. And just focus on the breath. Let's do the last one. Inhale to the right. Close the right. Open left. Exhale. And that's it. So if you can do that a couple of times, they call it like 3 series. So 12, if you can do 12 is 1 series. So if you can do 12, that would be great. So 1, 2, 1, 2, 1, 2, 1, 2, 1, 2. So you can just count. Because in the end, you will see why I was anxious. You will feel like, and breathing improve the pulmonary space. We call it anatomical dead space, meaning the space that normally we don't utilize for breathing. So yoga, this pranayama means, prana means life, yama means rules, regulation. So life regulation by breathing, that's what called pranayama, meaning breathing exercise. So yoga is not just a movement. Yoga is a breathing exercise. So you can't have a yoga class without a breathing exercise. So that's why I don't like a lot of people using yoga for like a exercise. That's not, it's supposed to be. Yoga is supposed to be your breath and body. So mind and body through the breathing, like a bridge. So you combine the mind and the soul and the body together in one system. Okay, so that's really good. So hopefully you can do a lot of those exercises. It's really good for your cognitive health, especially, just let go things like that, so just remember those Buddha's 3 things in life. You're not going to take anything to the grave. just remember, only three things matter. How much you loved by your family, by your friends, how gently you lived your life, all the years that you worked so hard, you brought up children, and the last one, by doing this, you've got to let go, that how gracefully you let go things that does not serve you anymore. Okay, with that, I will stop.
Thank you, Dr. Absar. That was great. Does anyone have questions? Go ahead, you can unmute.
I had to come to the class late. Will the recording be available?
Yeah, we'll send it out.
Thank you.
Mhm.
By the way, hope everybody was able to attend the first one, because this would be the second step. So if you haven't, just make sure Elizabeth can send you the first recording of the first session. So I think the both of them will complement each other, because I didn't cover a lot of the stuff that I covered last session. So that way, I think you have both of them at the same time. All right. I had a wonderful time with you guys.
Thank
So,
you again.
Thank you so
I'll
much.
be back soon.
Thank you. It was
Thanks again.
wonderful.
We
Thank you
Thank
again.
you.
It was great.
Thank you very much.
Thank you. Take care. Bye-bye.
Bye-bye. Thank you. Have